So I promised to keep you on track, but I'm excited.
All right.
So
You're ahead of schedule, do I tell you that?
No. Before I introduce our JDP clinician, Christina, I first want to thank and acknowledge Deputy Police Chief Todd Minardi for his vision and commitment to ensuring the jail diversion program became a reality. I would also like to say how proud I am of my entire staff and Officer Peters, who's really embraced the program. This initiative is taking place in other parts of the Commonwealth, but we are the first program of its kind in Worcester County. This is a regional endeavor Westboro initiated with advocates through a grant by the Department of Mental Health. The program serves 3 towns, to include Northborough and Southborough. The goal is to assist those in crisis, and I will tell you, we have been extremely successful to date. From April through June 2019, just in the town of Westboro, we have diverted 23 cases, have been forwarded to our jail diversion clinician. An additional goal of the program is to divert low-level offenders away from the criminal justice system and into more appropriate community-based behavioral treatment. Another goal is to reduce the number of individuals deferred to the hospital emergency department. Westboro police officers have deferred 6 individuals to our JDP clinician, which represents a health cost savings of $24,000. And now our JDP can refer these clients to appropriate care. So if I could have Christina come forward. So I really am. I'm honored to introduce our clinician to the board and the community. Christina received her bachelor's degree in criminal justice from Springfield College, as well as her associate's degree in drug and alcohol counseling from Manchester Community College. She went on to complete her master's degree in social work at Springfield College School of Social Work. Christina's previous work experience includes working as a substance abuse technician in individuals in prison setting, as well as those re-entering the community with youth and adolescents for the Connecticut Emerging Mobile Psychiatric Services, and as a social worker for the Massachusetts Department of Children and Families. In addition, Christina has interviewed with both interned with the Connecticut Department of Mental Health and Addiction Services and Department of Corrections. The goal of the Westboro Police Department is to provide public safety services that are second to none. Christina is a welcomed addition to the towns of Westboro, Northborough, and Southborough that is ensuring we meet that goal. And I know you join me in welcoming Christina to our community.
Wow. Wonderful credentials. Whoa.
So thank you very much.
Are we allowed to ask questions?
Yes.
Sure.
So, Chief, this is something that is near and dear to my heart. And I just wanted to find out, is this diversion program that you are having, is this similar to the policy that District Attorney Rollins has implemented, or is it distinct from that? She is, like certain low-level misdemeanor charges are dismissed. Is this similar to that? Is this different from that? Is it possible for you to clarify?
I believe it's a little different, but I'll let her explain what this program is all about.
So I'm not familiar with that, but this program was developed by Dr. Abbott actually 16 years ago. The first program was in Framingham in their police department, and they were a pilot program. Since then, it's expanded to 19 police stations. It is the only model in Massachusetts that's a co-responding, which means that I respond in real time with officers, whether I go to all of the calls. However, they know that I'm there if I'm able to assist in a call, or another town will call and they'll meet me. We'll go halfway, and then I'll go to that call and see how I can assist. So to answer your question, I'm not sure what that program is, but.
And will you be putting your thing on, I know you have a really great Facebook page. Will you be putting your presentation on your Facebook page?
Yeah, I'll definitely be sharing the breakfast with the chief.
Okay.
She did a great explanation at that event. It was when we had the zip trip in town.
Yes.
So I was in and out of it. But it's just a fantastic program. In one call I like to share in Southborough, we had a juvenile, with a knife, and we were able to, the Southborough police, through the great training that they provided us with de-escalation, be able to have a successful resolution with that. But she was able to spend considerable time with the family that we just can't do. So, I mean, this is a really win-win situation where last Thursday, she had 3 calls just here in town, a very sensitive investigation involving a woman. I mean, it's just a very valuable resource that it really does. It opens doors, and it's going to allow us, and it's not all about saving money, but allow us to get individuals to the correct help instead of dropping them off at the emergency room on a Section 12. So this is something I want to see here for a very long time. It's been very successful in a very short amount of time, and I really credit Christina and my entire staff, and as well as the other towns, for embracing this. I mean, they're fighting over. I mean, it's one of those programs. This is an absolute gem.
Chief, can you remind us the funding of this program? I believe it came
This
through
is
a grant.
completely grant-funded through DMH, Department of Mental Health. We did provide her, she has a portable radio. Another town provided her, body armor, bulletproof vest. We want to keep her safe. Now, we don't send her into hot areas or anything like that, but we just want to make sure that she has the tools she needs, God forbid, when a car stop, something happens. And the side benefit, like I said, she has a criminal justice degree, so she has some familiarity, with our profession. So this is going to be a great relationship for years to come. I can't thank advocates enough, for working with us, for allowing this grant, and like I said, to be the first program of its kind in Worcester County. It's really, this is special.
Yeah.
I'm excited.
It's very good. Yes.
I am very impressed with your credentials, being in
Thank you.
healthcare myself, but to have this mix between criminal system and the healthcare, and how terribly important it is to keep kids off the street. I've seen a lot of kids go through the high school, and they ended up going to family and community services, which was wonderful, but it didn't really stop the sort of escalation of charges sometimes. And we know when a young kid, I had a friend in our family who was urinating off a balcony, as a teenager, and he got charged with sexual misconduct, and on his record for like 6 years he was a sexual offender. All he'd done was gotten a little bit drunk, which was bad, and pee-peed over a balcony. I mean, it doesn't deserve 6 years on sex offender list. It interfered with his job opportunities, getting to school. It was terrible. And he was a really good kid who's now she's now a pediatric nurse practitioner. You can really get in the way of people's lives, and this sort of thing is just so critical and sensitive. So I want to thank you for having the background you have, for you finding somebody with this wonderful background and taking this. And in kind of in response to Syed's comment, you gave us this wonderful summary of advocates, which I'm assuming you'll be putting on your Facebook.
Sure.
And it explains the whole program. So thank all of your police force for really embracing this and finding such a great person to work with us.
Thank you.
We have an amazing police department.
Yes,
I could not do it without them.
I just want to thank you for being here and being part of the program, and for the chief and the department's initiative and support of the program. As Lee said, it's not uncommon for teenagers and young adults who are good people to make a bad decision. And if there's a way to get them the help they need to be on the right path and the support they need so that their life moves in a productive way and one bad decision doesn't become a lifelong stain or tarnish or impact, is powerful. And this is a great example of the range of services that we can offer as a town that make us a good place to live and to be. So thank you.
I don't have anything to add, but Christina, would you like to add something to the conversation?
Actually, I do. So it started off as a jail diversion program 16 years ago, but it's expanded into so much more. I'm able to assist the officers with a death notification, and often they don't have the time to sit there with a family and help them process it, help call family members, whoever they need to assist them in this process. I've been able to help support victims who come in to report a crime, all kinds of things. And I've noticed, the biggest thing that I've noticed is building that bridge between police and the community. Oftentimes, especially people with significant mental health issues, look at police and perceive a Section 12, or they're going to take me to the hospital. But the best part of my job is that I've been able to sit along with these officers and see they really care. They want to be able to sit there, but honestly, they don't have the time and they don't have the resources. There's so many people who call police stations now with social service calls, like, I'm getting evicted at the end of the month. I don't even know where to go for housing. I've helped a lot of people with that so far. So I think it's pretty endless where things can go. It's really exciting. So thank you for having me.
Excellent. Thank you so much. Great program. And Chief, thank you for bringing Christina here tonight. Thank you.
Thank you.
Thank you.